If a woman is not getting her menstrual periods, it can be a sign that her body is experiencing hormonal imbalance, stress, or nutritional deficiencies, and it's important to understand the reasons behind it rather than panic or ignore it. Menstruation is a natural biological process that occurs every month as a result of hormonal changes controlled by the brain, ovaries, and uterus, and when this cycle stops or becomes irregular, it's known as amenorrhea. There are two types of amenorrhea: primary, when a girl never starts menstruating by the age of 16, and secondary, when a woman who previously had regular cycles stops getting them for 3 months or more. The causes of missed periods can range from pregnancy, stress, sudden weight changes, thyroid disorders, polycystic ovary syndrome, PCOS, excessive exercise, poor diet, or certain medications. One of the first things a woman should do if her period doesn't arrive is to take a pregnancy test to rule out pregnancy, even if she thinks it's unlikely, because that is the most common cause of missed periods in sexually active women. If pregnancy is ruled out, then the focus should shift to lifestyle, diet, and hormonal health. Stress is a major factor that can delay or stop menstruation because it increases the hormone cortisol, which affects the brain's control over the reproductive system. Managing stress through relaxation, meditation, deep breathing, yoga, and adequate sleep can help restore balance. Regular physical activity also plays an important role. However, both too little and too much exercise can disrupt periods. Moderate exercise like brisk walking, light jogging, swimming, and especially yoga poses that target hormonal balance can be beneficial. Some yoga asanas that are known to support menstrual health include the butterfly pose, Baddha Konasana, cat-cow pose, Marjaryasana, Batilasana, bridge pose, Satubandhasana, and child's pose, Balasana. These exercises increase blood circulation to the pelvic area, reduce tension, and help stimulate the ovaries and uterus naturally. Along with exercise, diet plays a huge role in bringing back periods. Women who miss periods often lack essential nutrients like iron, vitamin B12, vitamin D, and healthy fats. A balanced diet rich in whole grains, fruits, vegetables, lean proteins, and good fats like those found in nuts, seeds, avocados, and olive oil can make a big difference. Including foods that support hormonal balance is key, such as flax seeds, sesame seeds, pumpkin seeds, and sunflower seeds, which are rich in phytoestrogens and omega-3 fatty acids. Iron-rich foods like spinach, lentils, chickpeas, and pomegranates help rebuild blood levels, while vitamin C-rich foods like oranges and bell peppers improve iron absorption. Women should also eat foods that support thyroid function, like iodized salt, fish, and eggs, because the thyroid gland is closely linked to menstrual health. Staying hydrated and avoiding excessive caffeine and processed sugar also helps regulate hormones. Weight management is another crucial point. Being underweight or overweight can both cause irregular or absent periods. Women who lose weight too quickly or have eating disorders such as anorexia often stop menstruating because their bodies don't have enough fat to produce estrogen, a hormone necessary for ovulation. On the other hand, obesity can cause excess estrogen production, which can also disrupt the cycle. Therefore, maintaining a healthy body weight through balanced eating and regular physical activity is essential. PCOS, or polycystic ovary syndrome, is one of the most common causes of irregular or missed periods. It occurs when the ovaries produce too much androgen, male hormones, leading to irregular ovulation, acne, and sometimes facial hair growth. Managing PCOS involves diet, exercise, and sometimes medication prescribed by a doctor. Women with PCOS should focus on low glycemic foods like vegetables, whole grains, beans, and lean proteins, while reducing sugar and refined carbohydrates. Herbal remedies such as spearmint tea, cinnamon, and fenugreek have also been studied for their role in supporting hormonal balance, but they should be used cautiously and preferably under medical advice. In some cases, thyroid disorders like hypothyroidism can cause periods to stop. Symptoms include fatigue, weight gain, dry skin, and feeling cold. A simple blood test can check thyroid hormone levels, and treatment usually restores normal cycles. Similarly, prolactin hormone imbalance, pituitary gland issues, or early menopause can also be underlying causes. It's important to visit a gynecologist or endocrinologist for proper diagnosis if periods don't come for more than 3 months without explanation. Apart from diet and exercise, certain natural remedies and lifestyle habits can help stimulate menstruation. Drinking warm water daily, avoiding extreme dieting, and having regular sleep patterns are simple but powerful steps. Herbal teas such as ginger tea, fennel tea, and parsley tea are known in traditional medicine for improving blood flow and relaxing the uterus. Ginger, in particular, is a natural anti-inflammatory and helps in stimulating menstrual flow. Including turmeric in meals is also beneficial because it improves circulation and balances hormones. Another helpful routine is abdominal massage using warm castor oil or sesame oil in circular motions, which increases blood flow to the pelvic region. Women should avoid excessive consumption of junk food, alcohol, and smoking because they can disrupt hormonal function. For those who have stopped menstruating due to stress or emotional strain, journaling, spending time in nature, and engaging in hobbies can help restore emotional balance, which indirectly supports hormonal recovery. Proper sleep of 7 to 8 hours per night is vital since sleep regulates the hormones that control the menstrual cycle, such as melatonin and cortisol. Women should also make sure they are getting enough sunlight exposure or vitamin D supplements, as deficiency in vitamin D can interfere with reproductive hormones. In addition to physical causes, emotional well-being plays a huge role. Chronic anxiety or depression can suppress ovulation, so taking care of mental health is equally important. If a woman's periods are irregular or absent after stopping birth control pills or hormonal contraceptives, it might take a few months for the body to adjust, but if the problem persists beyond 6 months, medical evaluation is advised. In teenagers, delayed periods are sometimes normal during the first few years after menarche as the body's hormonal system matures. However, if a young girl hasn't started menstruating by 16 or if there are other symptoms like excessive hair growth, breast changes, or vision problems, a doctor's assessment is necessary. Women approaching menopause may also experience irregular cycles, and this is a natural part of aging. However, sudden stoppage of periods before age 40 should be evaluated for premature ovarian insufficiency. For women trying to restore their periods naturally, consistency is key. Maintaining a daily routine with regular meal times, moderate exercise, and enough rest helps regulate the body's internal clock. Eating breakfast daily and avoiding long gaps between meals supports blood sugar stability, which affects hormone balance. It's also important not to self-medicate with hormonal pills without a doctor's supervision, as improper use can worsen the problem. In summary, missing periods doesn't always mean something is seriously wrong, but it's a signal from the body that balance is disturbed. By taking care of diet, managing stress, doing gentle exercises, maintaining healthy weight, and consulting a medical professional when needed, most women can bring back their natural cycle safely. Remember, every woman's body is unique. Some may recover quickly with lifestyle changes, while others may need medical help. The key is awareness, patience, and self-care. Your period is an important indicator of your overall health, and treating your body with respect, proper nourishment, movement, and rest will help it return to harmony.